Continue creating awareness about breast cancer. Joining us today to discuss cancer's impact on the Black community is Dr. Camelia Lawrence, the Director of Breast Surgery at the Hospital of Central Connecticut and Mid-State Medical Center. Doctor, welcome back.
Good afternoon, Lisa. Thank you for having me back.
Always great to have you. So can you tell us more about how breast cancer affects Black women?
Well, Lisa, what we know about breast cancer is that Black women are almost twice as likely to die of this disease.
And why is that, doctor?
You know, there are several factors that play a role. One has to do with access to screening as well as diagnosis of the disease. We do tend to see patients presenting at later stage, and later stage does impact the prognosis. For example, I often cite to my patient the woman who presented early stage with stage 0 breast cancer, which is also called DCIS. The 5-year survival is about 95 to 99%, in contrast to a woman that presented a much later stage, stage 4, that number dips to 25%. So it's really access to screening and early detection is key.
That early detection, you're right. All right, so doctor, what can be done to reach out to Black women and get more in for early screenings?
I think it's a multifactorial issue. It really goes down to screening, but it also goes down to education. I often say knowledge translates into vigilance. If you know that you're at risk, you may be more likely to be screened. We also almost need to create an ecosystem, because once a woman has an abnormality in a mammogram, what's next? How do we facilitate getting the biopsy to clinch the diagnosis?
And doctor, what is your advice for all women when it comes to breast health?
Breast cancer is a manageable disease when caught early, and early detection is key, as we mentioned before. And the overwhelming majority of cancers are found in mammography, may not be on a self-breast exam, so which is why it's so important for you to get your mammogram so it can be caught at its earliest stage when it's most manageable.
All right, doctor, you're a surgeon. Are you seeing any new technical techniques for breast surgery?
We're always evolving. There are always new techniques. A few years back, we're now focused on the hidden scar approach. Women who are at high risk or carriers of the BRCA mutation, they're now able to undergo nipple stem mastectomy, which from a vantage point of the woman, you can have the mastectomy done without anyone even knowing you've had surgery, but you have significantly dropped your risk of ever dealing with breast cancer throughout your lifespan.
All right, Dr. Camelia Lawrence, Director of Breast Surgery, Hospital of Central Connecticut and Mid-State Medical Center. Thank you for joining us. Great information.
Thank you for having me.